For our second big story, we'll be exploring the critical topic of health insurance in Nigeria. Now, with the recent developments in healthcare legislation and the challenges facing implementation, we explore the path towards achieving universal health coverage, UHC, UHC in our country. Now, in May 2022, the signing of the National Health Insurance Authority Bill raised concerns and hopes for improved healthcare access and affordability across Nigeria. However, months later, the full implementation of the law is yet to be realized, leaving millions of Nigerians without the benefits promised under the new legislation.
Now, joining us today to shed light on the issue, Dr. Olumuyiwa Olusanya. He's the MD and CEO, Insignia Health Limited. You're welcome. Thanks for joining us, sir. Good to have you here.
Good morning.
Good morning.
Happy to be here.
Now, let's talk about this new legislation here. Exactly how much promise does it hold for every Nigerian? What should we be looking forward to?
Yeah, it's supposed to ensure that most Nigerians are bought under the insurance net, health insurance net, ensuring that people have access to health insurance, reducing out-of-pocket costs and expenditure by Nigerians across the cities, urban areas, and even the small cities and villages, making sure that we're able to achieve the right indices for our healthcare in Nigeria, looking at things like maternal and mortality rates, infant mortality rates, and also reducing the scourge of chronic diseases, so Nigerians can actually live longer. If you're aware, you know that you remember that the current life expectancy for a Nigerian is still in the 50s, about between 50 and 55. And that has not really improved in the last 20, 30 years because of the issue of access to care, quality of care. And those are major issues that is driving all these poor health indices that we have. So with health insurance, this will actually improve all those indices.
Can you give us an idea of exactly how many Nigerians are covered currently when it comes to health insurance that makes this legislation crucial?
According to the NHIA, National Health Insurance Authority, about 50 million Nigerians are covered at the moment across all forms of health insurance schemes in the country. And this is social health insurance schemes, the one from the federal, which is currently run by the NHIA. And this actually covers majorly federal civil servants and some other small groups at the moment. Then we have social health insurance schemes run by all the states, most of the states across the country. I think this covers the largest group. Then we have private health insurance accounting for the remaining. So in total, we have about 50 million based on the data released by NHIA as at the end of 2023. And this is still about 5 to 7% of Nigerians' population.
Yeah.
So we're always hovering around that 5-7%. And you know the population keeps growing about 2-3% per year, which will keep outstripping the gap that we need to cover. That's where we are at the moment.
Now, earlier you were talking about the need for all Nigerians, healthcare insurance for everyone, right?
Yeah.
And the impact of inadequate health insurance coverage on Nigerians is, I mean, humongous when you think about it, such as increased out-of-pocket payments, expenses, and also reliance on unregulated healthcare options. So can you just elaborate on the consequences of these challenges? Now, we know the challenges, but what are the consequences of these challenges?
Truth needs to be told. No country can develop, no country can be productive if the government does not actually prioritize healthcare. Because for human productivity, for performance, healthcare is the basic, it's like where you need to focus on. That's where you need to invest in. When people are healthy, they have access to the right healthcare. They're living very, very purposeful life. They're healthy, they're strong, they'll be productive. And if you look at developing countries that are actually making strides, you realize that there's a lot of focus on healthcare. Look at the UK. There is no day the Prime Minister opens his mouth to talk. He's talking about healthcare. Healthcare drives the whole of that country. The same for America, because that's where you can get people productive. If their healthcare is messed up, they are not fine, they are not covered, they have a lot of issues, they will not be productive. And the government needs to come back to this reality, because what is happening is that although we spend a lot of money in healthcare, but I need to say the truth here, most of the money goes to infrastructure, not providing services. Infrastructure does not drive productivity. So if I'm building more private healthcare centers and building more state-of-the-art hospitals, that doesn't mean that the people are well. That doesn't mean they have access. Who pays for those services? Do they actually have access to those services? Are they shielded from catastrophic payments for healthcare and the conditions that they're exposed to? So those are the issues we're supposed to be looking at, that actually investing in healthcare drives productivity, and that should be the focus. And I will bring us to this before I round up on that. About 46 or so of the renewed hope agenda of President Tinubu, he mentioned it there, that they are going to remove subsidy. And when they remove subsidy, they are going to take most of that money to provide universal health care for Nigerians. It is there. It is there in the manifesto. What has happened? Subsidy was removed. Then before you know it, all kind of things started happening. They're talking about palliatives, giving money to state governors. Then you have the better do saga, a lot of things. So priority is what we need to realign.
Refocus.
Yes, we are always spending so much money on infrastructure, which is good, but infrastructure does not give access to care.
So on that now, let's talk about the vulnerable Nigerians. How exactly does this legislation really affect them or profit them?
One good side of this legislation is that it's made provision for the vulnerable group, Nigerians that are indigent, that can't afford to pay. The criteria has been set, although that criteria is debatable. In Nigeria, when something is free and they say we're going to provide free healthcare for certain, everybody will say, I'm in that group, I don't have money, and all that.
Who doesn't like free
Yeah,
things?
that's what always happens. But it has to be stringent in such a way that is driven by merit to capture that number of people. I think that number has been put at about between 50 to 100 million people to make impact for the first phase. I think they've also identified sources of funding for the vulnerable group where contributions will come from different sectors of the economy so that there can be money to at least arrange for the premiums of those people. So it's in the legislation, which is good. It's good. But it's execution that we're talking about now. The next phase is let's execute it. If this is a priority of the government will bring all areas of the economy together to actually drive this agenda. I'm seeing a lot of distraction. I'm seeing distraction because where health is supposed to be, we are not there. We are not there. And as long as we continue to pay lip service to healthcare, providing healthcare, access to healthcare, then we're going to drive, we need to stay behind in terms of productivity. That's the way it is.
We're talking about federal level. Let's come to state level and the role they play as well in terms of health insurance schemes. And we understand that Lagos State has their own insurance scheme as well. And of course, it is crucial in terms of extending healthcare coverage for all Nigerians. But what steps can states take to strengthen their health insurance programs and ensure effective implementation, which was one of the points that you made earlier?
Yes, I think the states have done well. There's a law that actually supports states establishing their own state health insurance schemes. And also there's support from federal government from the Basic Healthcare Fund, which is 50% of the 1% of the consolidated revenue of the government. So 1% of the budget goes to healthcare, and they split into two. 50% goes to the Primary Healthcare Development Agency to drive primary healthcare, and 50% goes to Basic Healthcare Provision Fund, which actually 50% goes to health insurance, and that is shared among the states. And this is based on condition. You set up your state health insurance scheme, you run a scheme and all that, and you meet certain criteria, you get that money every month. So that has encouraged a lot of states to set up their agencies, and they are running their own social health insurance scheme. So what I'm proposing is that there must be synergy, there must be cooperation between the private sector and the government. We have private health insurance, HMOs running their private scheme. For there to universal health coverage, there must be everybody come together, let's drive this agenda. Not everybody can afford private health insurance. The law already says that social health insurance is mandatory, while private health insurance is now complementary or supplementary. If you're going to make everybody buy social health insurance, the truth about it is that social health insurance might not provide or address the needs of every Nigerian. So what it means is that they're going to be taxed twice. They'll pay for social health insurance, they also go and buy private health insurance. I'm advocating that that law, that area should be looked at so that it should be either or. You should have a form of health insurance, whether it's private or it's social. So that's the way it is, so that you can encourage more people to come. And also they have other things actually competing for that money. Because we're talking of inflation, our cost of things have gone up. People are even struggling to buy food at the moment. You now have to force them to buy two health insurance.
I wanted to jump on something you said. You mentioned the private sector, rather.
Sector.
I get a bit tongue-tied here. Yeah. You mentioned the private sector and the contributions that they make. But if the private sector is driven by profit, exactly how can they make these contributions to this system, this legislation? Could it be free from them?
Okay, so the way it works is that the private health insurance actually, in a way, contribute. They pay regulatory fees. They pay regulatory fees to the National Health Insurance Authority. So they're actually paying, they're contributing something. Their regulatory fees currently is 1%. And the law is saying it will increase to 4%, which is actually very astronomical, given the economic situation and the challenges private health insurance are facing at the moment. Most are not even profitable because of the challenges and the cost of healthcare. Now they are contributing something to the NHIA. This money can be used as part of the money that will be used to support the Vulnerable Group Fund.
So you've noted that.
Yes.
But I was faced with the instance of having to pay insurance for my family recently. Yeah. And the private insurance, by the way. And it is astronomical. So what's going on here? What you saw last year?
Yes.
It's a 100% increase this
year. Yes. Inflation, cost of drugs, consumables have gone up because everything is driven by Forex, is driven by the dollar. Most of the drugs that are used in Nigeria, let me come down to basic drugs. The common or the commonest condition treated in all hospitals is malaria. Are you aware that most anti-malaria drugs are not made in Nigeria? Pick any anti-malaria drug that are advertised. Just look at the pack, made in China, made in India. A couple of companies are setting up their GMP-approved factories, which some are starting this year. I pray that will reduce that. But the truth is, most of the drugs we consume are still imported. So inflation, Forex volatility affected the price, and the prices went up. And that's why most leading pharmaceuticals are leaving the country. GSK has left, Sanofi has left, because they just couldn't, it was not sustainable. The only way they could remain in the country is to cut corners, and they were not going to do that.
So which would be more effective, do you think, your expert opinion, to actually make these medicines cheaper by creating environments for these foreign companies to start manufacturing here in Nigeria, or to make healthcare affordable? Because if you make that healthcare affordable, you're still going to be faced with the amounts you're talking about when it comes to purchasing drugs. It's still going to be high. So how about making these companies attractive, or making the conditions attractive for companies to come in and manufacture drugs in Nigeria? Your take?
At the moment, the solutions, and I know the government has considered one or two of those solutions that we prefer as an industry, is to reduce taxes, custom duties on drugs and consumables and some equipment, so that we can manage this inflationary exposure that we're in at the moment. Things are too expensive. And if you prioritize healthcare, you're able to reduce some of those costs in healthcare, then the price of the drugs can come down a bit. And that's where we are at the moment. Government announced about 2 or 3 days ago they're considering reducing import duty licenses on drugs and some healthcare equipment and all that. If they implement that, that will reduce the cost of drugs, and that can help with inflation.
Now,
and pricing of insurance. Yes.
As we're talking about, the drug and medicine sector, or pharmaceuticals arm of it, let's also talk about a small group that we're not focusing on. And you know that group? Do you know who that group? Those with underlying issues as well.
Yes.
Nigeria has a huge number, and sometimes they're overlooked. And when you go to the private sector and all the private HMO providers, there are cases where you cannot list people with underlying issue. 9 times out of 10, you cannot. And so how then can we, if you're saying health insurance is for all, is there no disparity in that? And how can we now be able to scale that to make sure that it is really covered? When you go to the north, there's situations of, there are cases of, diabetics and, asthma, so many things. And when you come to the east, there's another situation. And we have a problem. A chunk part of our population has underlying issues. How can we cover them?
The cost of providing medical care for chronic medical diseases, which represent most of the pre-existing conditions in insurance, is very enormous. And the truth about it is that it's not only in Nigeria, it's everywhere. And the only way to bring down that cost is to ensure that coverage is increased. Because the way insurance works is that it's about risk. So if you're able to spread the risk over a larger population of people, the cost, the premiums will come down. The challenge we're having right now is that the pool is still small. And so when somebody that has chronic underlying pre-existing conditions comes to buy health insurance, if you are not under a group policy, for example, a corporate group policy, or you are not from a group, if you come individually, your premiums are going to be very high because your risk is going to be assessed. Just like you want to insure a car. You know, no insurance company will insure your car if they don't come to inspect that car. They will come and inspect the car to say that, okay, this is the state of the car. This car is functioning, is actually in good state, is well kept and all that. Then they will now say, okay, this is the premium that you should pay. And after they've done that, they will still review from time to time. So it's the same way. Somebody wants to buy health insurance. If you're coming alone, it's actually more expensive. If you're coming under a group, those pre-existing conditions can actually be covered. So under a group, somebody has hypertension, has diabetes, has sickle cell, all those things are covered. It's now the scope and the extent we're talking about. So the first thing is that expansion of the coverage, more people comes in, that risk will be cross-subsidized across the entire population, and the premiums will come down. And that's where we're saying that focus on healthcare to drive universal health coverage to ensure that everybody comes in. Because at the end of the day, we'll spend less when everybody is under that net, one way or the other, and making sure that that risk comes down and everybody can access healthcare. Basic healthcare is what people need to access. You will be shocked at how many people die of malaria every day. You will be shocked, you know. And those are the kind of things that access to care can handle. Because once somebody doesn't have health insurance, the behavior, the way they seek health is different. They will actually be evasive. They will not want to access care on time. There will be delays, and when they access care, there will be a lot of complications already. So when you have access to health insurance, the behavior is better. You have better healthcare seeking behavior. You go to the hospital on time. Diagnosis is made on time. Complications are prevented.
In your expert opinion, with this legislation in place, where do you think this access to basic healthcare insurance will lie? I mean, what amount, what figure do you think it might be?
Well, right now, some of the cheapest plans on the social health insurance schemes range between 8,000 naira, 8,500, I think the one for Lagos State, and the one for federal government, the one run by the NHI scheme. NHI for federal civil servants about 15,000. Although those premiums, as I speak to you, are no longer sustainable. For the NHIA, an actuarial study is going on right now. The DG said it recently. There's commissioned two actuaries to actually look at the current pricing and to come up with the right premiums for the NHIA scheme. And I believe that Lagos State is also doing the same, so that the pricing can be realistic. But the idea is that we need to move forward on that policy. Health insurance is now mandatory. Government to ensure that all parties, government and private sector, work together to drive coverage and to make sure that people can choose the plans that they can afford. That's what I would recommend. Thank you very much.
Olumuyiwa, you've been quite a good sport
The
this
best
morning.
man for the job.
I'm telling you, very insightful.
Exactly.
Very insightful and very pertinent issues as well as raised. And we do hope that that all the right authorities that are watching and listening, hopefully will be able to take a pointer here and there to just help fine-tune healthcare. It's very important and very crucial, especially at this time, given the cost of living.
Thank you very much once again, Dr. Olumuyiwa Olusanya is the MD CEO Insignia Health Limited, and of course he's giving us his expert opinion. The right man for the job, like I said before. Thank you once again.
Thank you for having me.
Do stay tuned because we have coming up sports for you, and then the news, and then more inside of Breakfast Extra.